Yeah, sure. So I worked at Kaiser Permanente for 30 years and was for, the first 8, 10 years a busy primary care doc and was starting to burn out. I got this after 7 years or so, as is common. And I was just itching I had learned the Ayurveda and through a number of venues and courses and was just itching to introduce it into my practice. And I got permission from my superior officers to do so and did a few consults with my own patients. And then I collected data and the patients loved it. And this turned into a consult service. And so over time, this grew to be eventually I ended up with two practices at Kaiser, one my primary care practice, and the second one, a referral-based natural healthcare clinic based on Ayurveda. And the referral-based clinic would start with a 2-hour group clinic. Everyone would come to that first. This is 40% of my practice. And they'd learn the basics of Ayurveda, the vocabulary, Vata, Pitta, Kapha, Ojas, Ama, Agni, the basic concepts, and basic lifestyle recommendations regarding guidelines to proper digestion and daily routine. And then they'd come back for a pulse assessment and the full consult. And then my primary care practice over time became busy with patients seeking this type of care as well. And back in the 90s, I'm dating myself. People didn't talk about this at all, but by the time it got to be 2010, 2015, the clinic became very popular, the referral-based clinic, it was very common for all specialists to refer to us. The gastroenterologists would, on a systematic basis, send us their functional bowel patients. And they would come to see us in integrative medicine, having been scanned and scoped and scanned again and scoped again. And then they'd eventually get referred to us. And just a few ridiculously simple dietary and lifestyle interventions. And you get just remarkable results. And the gastroenterologist, they would write chart notes saying patient went to integrated medicine clinic, now 90% better. And then they'd copy me the chart and thank me. And this became a common thing. Every specialty, the rheumatologist, the oncologists, the pain clinic, the uh, endocrine clinic, they'd get these patients who would come to see them. Um, they get these referrals, patients who are convinced that they're hypothyroid and have normal thyroid functions. And then they tell the patient you're not hypothyroid. Well, the patient's mad. Come on, give me something. You're telling me I'm not hypothyroid, but you're not telling me what to do. They'd send them to us, and then we have a whole toolkit to assess the patient who's fatigued and tired and cold and but has normal thyroid functions. Well, your thyroid functions are normal, but there's something else going on. You've got the TOF imbalance or whatever it is. And we have tools to help those patients who the endocrinologist couldn't help and could only send away with, we don't know what's going on. So it's very, very powerful set of ridiculously simple, astonishingly powerful recommendations that you can use right away.